Hey guys, I'm here to talk to you about Medicare, give you a nice 40,000 foot overview. If you are brand new to Medicare, I do have a separate video for that. So please watch that one instead of this. But without further ado, I am going to share my screen. So first off, my name is Tim Gustafson. I've been an insurance broker since 2005. I focus on the four main staples of retirement, so Medicare, life insurance, long-term care, tax-deferred asset protections. I'm looking forward to talking to you about Medicare. I have a beautiful wife, two awesome kids, and the two world's most okayest dogs. And the two quotes I want to give you an idea of who you're dealing with and what kind of person I am. So the two quotes that I try to live by are that with those with good intentions make promises, those with good character keep them. And, I like to have character and not just intention. So I try to do everything I can to you know uh, do what I say and say what I do. And then the other one is I live my life so that those that know me but don't know Christ want to know Christ simply because they know me. That's a powerful quote. I'm far from perfect, but it's something I strive to do as well. So Medicare, the very first step is going to be signing up for Medicare A and B. If you have started drawing Social Security prior to age 65, no action required. It's going to be automatically done for you. If you're not drawing Social Security, then you do need to either apply at SSA.gov, call 1-800-Medicare, go to your local Social Security office, or there's a paper application. I believe it's on my website. If you have delayed your Medicare Part B, so you turned 65, but you were still working and did not sign up for Medicare Part B, there is a little bit more of a process for that. You do have to fill out the paper application and then also get a credible coverage form so you don't get penalized for not signing up when you were first eligible. After you get your Medicare A and B, there's kind of two options. You can either go with a Medicare supplement, leave Medicare as primary, pay an additional premium to have a supplement so you don't have any co-pays or anything like that, get a separate prescription drug plan, but you do have an additional premium, or sign up for those Advantage plans that typically have no additional premium and just have co-pays as you use it. The standard premium for Medicare Part B as in boy in 2023 is $164.90. If you are blessed with a little bit of a higher income, you do have to pay a little bit of a higher premium for those. Um, and then the Part D, same thing. The standard premium is about $134.71 if you sign up for a prescription drug plan with a Medicare Advantage. Typically, there's no premium, but if you do sign up for an additional one, you may have to have additional premium involved there. And with this, no further ado, just kind of go right through it. So Medicare Part A is the hospital benefit, covers you in the hospital for the days 1 through 60 in any one hospital stay. There's a pretty hefty deductible at $1,600. There's covers very limited home health care, covers hospice care, and there's absolutely no premium as long as you or your legally married spouse worked for at least 40 quarters or 10 years. Medicare Part B as in boy is everything else. So all doctors, specialists, CAT splints, x-ray surgery, ambulance, MRIs, lab work, blood work, occupational therapy, physical therapy, chemotherapy, anything like that. And then there's a $226 deductible, and that's an annual deductible, and that is not prorated at all. So even if you're joining Medicare in like November or December, you still have 226. And then it's an 80-20 plan. Medicare covers 80, you would have to pay 20. And then Medicare Part C. The way that these came about is private companies went to the government and said, okay, if you have Medicare A and B and you need an MRI, you have to pay the deductible and 20%. Well, 20% of what? These people would never have any idea what they would have to pay prior to having any services rendered. So they went to the government and said, hey, we got a great idea. Why don't you have Medicare pay us to be primary? We'll sign them up for an HMO or a PPO type plan. And you essentially sign a contract with that private company. So forget about the 20%, forget about the high deductibles. You would just have to pay whatever copays listed on that contract. So 0 for a primary care doctor, 25 for a specialist, things of that nature. And I'll go in more detail on that in a second. Then Medicare Part D, as in drug, is just that. It covers your prescription drugs. So they break down the drugs into those 5 different tiers that you see there. There's not one Medicare Part D plan that's actually done directly through Medicare. They're all done through private companies, and they all follow the Medicare standard. So they all have to have the deductible and then the initial coverage period, the donut hole or the coverage gap, and then lead you on to the catastrophic coverage. And so kind of the cheat sheet kind of compare these. So Medicare Advantage plans, there's typically no or low additional premium. There's even some plans that help offset and pay a portion of that Medicare Part B, that $164.90 a month premium. Then you just have to pay copays as you use it. There is a network of doctors. Most companies have gotten away from referrals, but it's possible that you may need a referral. And then there's also a max out of pocket. So if something catastrophic happened where you racked up like $20 million worth of medical bills, you have just Medicare A and B, there's no limit. So that 20% could be hundreds of thousands of dollars of out of pocket. But with these plans, when you sign up, there's usually a max of anywhere between $3,000 to maybe about $7,000, where if you racked up $20 million worth of bills, you don't have to pay copays always and forever. Once you've paid that $3,000 or $7,000, or I think even somewhere as low as $1,000 out of pocket, then you're 100% covered. They also typically include a prescription drug plan. They don't have to, but a lot of times they do. And this is where you get all those extras that you hear about and see all those commercials for and everything else, where it has dental and vision and gym memberships and over-the-counter items, hearing aids, and that kind of stuff. So your estimated cost with this would be your Medicare Part B, as in boy, premium, plus any Advantage plan premium, plus any copays that you pay throughout the year. Supplement is a little bit different. Medicare supplement, again, Medicare A and B remain primary. This is your secondary or supplement or Medigap, where you pay an additional premium and then you have no copays. There's absolutely no network or referrals are going to be required or anything like that. And then the plan that I talk about, if you live in a state with a standardized plan with the A through N type plans, I typically enroll people in the G plan, where the only out of pocket would be your Medicare Part B deductible, that $226. These plans do not include their own prescription drug plans. So you do have to get a separate Part D, and they typically don't have any extras. We may be able to get gym membership covered for you, but very little outside of that. And your estimated cost here is your Medicare Part B, as in boy, premium, plus your Medicare supplement premium, plus your Part D premium, plus your deductible. And other than that, you're 100% covered. So I want to thank you so much for your time and attention today. Looking forward to meeting with you on more on a one-on-one basis to get you your individual plan and do your analysis to find out what plan is going to best fit your needs. Thanks again. Bye.